Hey everybody, my name is Katie McCabe. I am one of the clinicians that works at the resource group here in Towson, Maryland. And today's topic for all you out there in Instagram land is warning signs of adolescent substance abuse. Now I know that sometimes it takes a minute or so for people to log on and get all their stuff ready to go. So before I launch into my topic, I'm going to just give you a brief bio of who I am, so you know that they just didn't randomly pull me off the street in order to do this. I'm a part-time clinician that works here at the resource group, and I've been here for about almost 4 years now. I have been a counselor for 25 years. I'm a University of Maryland graduate, go Terps, and I got my master's degree at Indiana University, and my first job right out of grad school was an adolescent substance abuse and mental health job, which I definitely did not mean to get, but they hired me on the spot and offered me money, and I did that job for the next 14 years at a place called First Step in Cockeysville, where we did adolescent substance abuse groups, individual evaluations, and worked in Baltimore County middle school and high schools on student assistance teams, SAP teams, which are sort of like EAP programs in businesses. I did that for 14 years. Then I had 3 sons in 18 months, which I wouldn't recommend to anybody. When I finally went back to work full time, I got a job as the program director at Gaudenzia Owings Mills, which was a 4-month inpatient program for people who were still incarcerated, typically from Baltimore County Detention Center. We had some people from prison, sometimes some regular people got to our program. I did that for 2 years and then downshifted to part-time when my kids got a little bit older. And I worked at Shepherd Pratt on the inpatient locked psychiatric units in Towson for 5 years, on the boys' teenage unit and the girls' teenage unit as an adolescent substance abuse counselor. I did evaluations, and now I work here at Resource Group and have been here for the last 4 years, part-time. I'm an individual counselor, primarily working with the clients that are in the intensive outpatient drug and alcohol adult program. I also run a group once a week, and I've had the opportunity to supervise many of the clinicians here who are working on getting their licensure to be master's level clinicians. So that's who I am. I've been working at home since March, so actually coming out in the community and into my job is a little strange, but hey, here we are. So, gosh, I kind of feel like sometimes everyone's been in the house and stuck, bored, depressed, lonely, all of those great characteristics that can add to a potential substance abuse issue, maybe start one up, maybe worsen one that already exists. So this one is about teenagers, right? I reached out to a couple clinician friends of mine that I used to work with and who worked primarily with teenagers, and their overall thought was kids are bored. And a lot of kids, I think, unfortunately, are also sitting at home watching their parents drinking, maybe their parents' drug use increase. We all know that there are kids who go to school to escape from problems, right? Because there might be addiction at home, there might be domestic violence, there might be child abuse. So this is just a really important topic, I think, to pay attention to right now, because the kids that are already having substance abuse problems are probably just increasing their use, because they don't have really any structured activities. We know on the adult side, things are not as easy, not that addiction is ever easy, but not as easy as they have been in the past. 12-step meetings have shut down, everything's online, people are not having access to one another, there's depression, there's isolation, all the stuff that addiction typically feeds on, right? So the first thing I'm going to talk about in terms of adolescent substance abuse is the idea that as parents, and again, I have 3 sons, it's important to understand that drug and alcohol use in teenagers isn't a one-off. As my old boss, Jim Perrone, used to say at First Step, it's practically a developmental stage at this point. All kids are going to have to figure out what their relationship is to drugs and alcohol. We're certainly saturated by it on TV, in the neighborhood, in schools, in movies, everywhere. We live in a society that glorifies substance use, and then we expect our kids never to do any of that. So I think it's important for parents to realize if they have a kid who's dibbling and dabbling or getting into stuff, that doesn't make you a complete failure as a parent. In this society, we don't understand mental health and we don't understand addiction at all. We just still think it's a moral failure, and parents are like, oh my gosh, I told Johnny that drug and alcohol use was bad. Maybe I should have sent him to another week of lacrosse camp. And unfortunately, that's not how it works. I think as parents, the number one thing that you need to do is to look at your family history. Genetics, genetics, genetics. That's the number one risk factor as to whether someone is going to have a drug and alcohol problem, right? Doesn't matter if it is someone you never knew, someone who maybe died before your child was born, maybe somebody your kid didn't have access to, but genetics determine so many things. Hair color, eye color, height, body shape, whether or not someone's vulnerable to diabetes, cancer, heart disease, and certainly mental health problems and drug and alcohol problems. And if we look at what is addiction in general, it's a brain illness, right? We can take anyone adult, kid, who might go out and use drugs, drink too much, and have a negative consequence. That doesn't mean necessarily they're alcoholics or drug addicts. The first thing that we have to understand about addiction is that addiction is a disease of more, right? So when I am teaching people, what does addiction look like? And I used to go into school, 9th grade for years, at Towson High School, Loch Raven High School, and I would talk to the 9th graders about how can you tell somebody has a drinking problem versus somebody who's being kind of a knucklehead. And the first thing I talk about with any addiction, whether it's gambling, sex, drugs, alcohol, is that addicts typically have no off switch. Once they start, they're off to the races, right? And sometimes people have this idea in their head. Well, not sometimes, all the time. This is what an addict looks like, particularly if you grew up around addiction. My brother's an addict, my father, my grandfather. And if you don't use exactly like that, you think, I'm safe. And so you have a lot of people having that misperception that, alcoholics are old men who live under bridges with trench coats. Or, they have to get arrested a million times. Or they have to be drinking straight out of the bottle, pop-off vodka. And really, people are missing the point. They need to look at the style in which people use, not the frequency. Because we know that addiction gets worse over time. I always explain it like a little cartoon snowball rolling downhill. At the top of the hill, it's really tiny. And by the time it rolls down to the bottom of the hill, it might be huge. So when I would talk to the young kids, I would say, look for how somebody uses, not frequency, because frequency will increase over time. So anybody could go out, get drunk, get high, and have a negative consequence, right? Then what happens? Normal people, normal kids, normal adults will then stop. They won't do that anymore. They put their hand on that hot stove, they get burned, and they're like, that stinks, and they don't do it. They don't miss it. They don't obsess about it. They don't sneak around. But then there are the people, some of whom have family histories, who drink and drug for the first time, and their reaction is different, right? Now, they might, from the jump, have their first drink, have their first drug, and almost be off. Like, where has this been all my life? Right? Now, many people are like, say no to drugs. I mean, I'm 49, right? I grew up in the Reagan years where Nancy Reagan was like, just say no. And it's not as easy as that. You put drugs and alcohol into a body that's primed for addiction, that's vulnerable to addiction. And I think aside from having no off switch, the other thing I've seen over the years are people with anxiety. You put those two things together, and people are going to have an enormous amount of relief when they drink and drug for the first time. They're going to wake it up, right? They're going to wake up that addiction. And surprisingly, it's not always drugs and alcohol that wake up an addiction potential in someone. It's actually cigarettes, right? It's actually nicotine. And that wakes up all those sort of systems, all those chemicals that make them go, oh, I love this. Now, when I did adolescent counseling, I used to teach the kids, there's an easy way to tell if you have a drug and alcohol problem. Quit. Because normal people can walk away from stuff. Adults, teenagers, you can walk away, not give it a second thought. You don't miss it. You don't obsess. Like I said, you don't sneak. Addicts and alcoholics, very characteristically, will do whatever they need to do in order to continue using, even quitting. right? Most alcoholics and drug addicts will tell you anything that you want to hear so you'll shut up and go away. They'll be like, yeah, Mom, I plan on quitting. I plan on doing this. And then they're just biding their time. So back to that family history. Do a family tree. If nothing else from this whole talk, do a family tree. Sit down with your kids. What sort of health issues run in the family? What sort of mental health issues run in the family? What addictions run in the family? And not just drug and alcohol addiction. Is there workaholism? Is there hoarding? Are there people with OCD? Because I actually, and I've had some discrepancies from other professionals, but I think addiction is very similar to OCD. And my goodness, if you have somebody with a family history of addiction and they personally have issues with OCD, that's a tough nut to crack. But find out what runs in the family. Now that might be difficult because in addicted families, there are 3 unwritten rules. Don't talk, don't trust, don't feel. Don't talk about what happens in this family outside of this family. So when the rule is don't talk about what happens in this family, there might be decades, there might be generations of nobody talks about, grandma was alcoholic. I remember very clearly talking to an adolescent client, mom in the room at the beginning of the session. I asked the mom, is there any alcoholism, drug addiction, anything like that in your family? She said, I got the kid by himself. He's like, yeah, grandma's drunk every day. Nobody called that alcoholism, right? So when you're doing that family tree, you don't always have to look for those names. Things don't always have to be diagnosable. What do you think? Because it's important for kids to understand that they might, especially if they have a family history of addiction, their bodies might respond differently to alcohol and drugs than like for the other kids. Now, if we look at the basic personality of somebody who's an alcoholic or a drug addict, what do you see? Stubborn, willful. You're not the boss of me. That doesn't mean that quiet kids can't, have drug and alcohol issues. But as parents, you need to know what runs in the family. Secondly, you need to be setting, this is going to sound preachy, but it is, you need to be setting an example for your kids. If you're home with the box of wine in the fridge and like the glass of wine bigger than your head and then saying, don't do it, the kids are that's an easy one for kids. They're just going to look at you and be like, you're a hypocrite. Typically, when I did adolescent drug and alcohol counseling, our family therapist would ask parents to stop drinking out of respect and in solidarity with their kid. It was just easy to remove that. Mom, you're a hypocrite. How can you tell me to not smoke weed if you're still drinking? And the parents that didn't have drug and alcohol problems were able to do that quite easily. Sometimes parents actually got sober through our program because they realized, wow, I can't stop.